talk about the hip bone. So here is the hip bone. Let me tell you how it belongs to the right side. So now here this is of right side. How did I say that? You can place your thumb on this one, ischial tuberosity, and you should be able to hold it in a stable position. So you can see this anterior superior iliac spine facing forward, anterior inferior iliac spine facing forward. You can see similarly posterior superior and posterior inferior. And this one, which is below the sciatic notch, is ischial spine. Below that will be the ischium. So this portion is ilium, this is ischium, and this front portion is pubis. So this portion is called the ramus, which is contributed both by the pubic bone as well as the ischium part of the hip bone. So this is how you place it, and acetabulum is facing laterally, and you can also see a area which articulates with the sacrum that is facing medially. And you can also identify some lines on this real original bone, and they are called the gluteal lines. So there is one inferior one, there is one intermediate one, and there is one posterior. So posterior most will be gluteus maximus, middle will be medius, this will be for gluteus minimus. What is on the iliac crest that we'll see? So this portion, posterior portion, you remember two L's. Okay, one is quadratus lumborum, another one is latissimus dorsi, along with the ligament that is called the sacroiliac fascia and the ligament. Okay, so anteriorly what do you see? You see four muscles, that is, you can remember it as IT, ET. What is first one? I is internal oblique, T is transverse abdominis, E is external oblique, and tensor fascial lata. So these are the four muscles on the iliac crest in front, and posteriorly you can see two L's. Okay, so now this portion is for the gluteal muscles, and what is attachment on this IAS? That is two things. One is sartorius, another one is inguinal ligament, which is also called the Poppert ligament. And this is inferior one, and here will be the attachment of rectus femoris. Rectus femoris here. There is one straight head and reflected head here. This is acetabulum. This is for the transverse acetabular ligament. So this is about the anterior portion. Coming to the posterior portion, you see a big notch, that is greater sciatic, which is divided into two parts by piriformis muscle into upper and lower portion. Through lower portion, you will see the emerging of the sciatic nerve. This is the lesser sciatic notch. So these two are converted into foramina by two ligaments, that is sacrotuberous and sacrospinous ligament. And here will be one more ligament that is called the sacroiliac ligament. Alright, so this is about those structures that are on the upper portion. Coming to the lower portion, which is ischium, there will be three muscles. They are the hamstring muscles on this portion. Coming to this portion, this is the obturator foramen, obturator internus membrane, and the muscle. Here will be the obturator externus, and this is for adductor magnus. Here will be adductor longus, rectus abdominis, and here will be the pectineus along with the pectineal tubercle, or this is also called, this is the pectineal line. So here will be the tubercle that is called pubic tubercle. So pectineus is here, piriformis is here, and there is rectus abdominis, adductor longus, adductor magnus, obturator externus. This is for the hamstrings, and this is for the rectus femoris. Rectus femoris another head, and this is ASIS. So this is all on the external aspect. Coming to the internal aspect, here will be the iliacus. Okay, so that is for iliacus, which forms a common tendon with the psoas major, and it is attached to the lesser trochanter of the femur.